starting our PBL session for today. First of all, we'll choose out the group leader. Who will be the group leader for today? Alright, let's see. Okay, scribe, Komal, you can scribe for today, down the board. Next, timekeeper. Alright, Lubna, we are timekeeper. Okay? Lubna, can you tell us the time right now? Alright, the session will be of 1 hour duration. Keep telling us every 15 minutes. Okay? Oh, we could see how to proceed. Read the scenario loud.
First, let us discuss the ground rules. That first of all, no crosstalk. Secondly, if anyone wants to add anything, please raise your hand and then only speak. And let's review the scenario. A 29-year-old male Salim visits his GP complaining of cough and hemoptysis. He is a non-smoker. He has also noticed some weight loss. On examination, he is anorexic and clammy with a raised temperature. Blood tests show a reduced white cell count amongst other abnormalities. Past medical history includes a blood transfusion following RTA 2 years ago, that is road traffic accident. He is married to Lubna, who is 24-year-old with a 1-year-old baby. The GP ordered an HIV test that came back HIV positive. How would you approach the patient in light of the disease pathophysiology, signs and symptoms, complications, treatment, and implicit social issues? So what we have over here is that first of all, after the way we proceed is that after discussing the key points in this, we will have to, the main point that they have asked us is that how we have to approach the patient in terms of the signs and symptoms. We don't have to discuss it, we have to tell how we will approach the patient in terms of how will we inform him, what are the complications going to be, what are the signs and symptoms, and what will this, how will it affect his life in the long run. So let's start by highlighting the key points.
29-year-old age. Weight loss. Non-smoker. Immunocom.
Blood transfusion. And 1-year-old baby. Who raised them?
Non-smoker.
And HIV positive.
RTA 2 years ago. RTA 2 years.
Right.
2 years ago.
Non-smoker.
So I want to ask something. If the person made a done solution, there is downstream maybe nothing wrong with him. So there's a mild symptom, nothing weird.
Let us first discuss it like what are his presenting complaints? Anyone can add what are his presenting complaints?
He's complaining of cough, hemoptysis, and weight loss. On physical examination in the physical exam, he has raised temperature, and on pathology we have seen that he has reduced white blood cell count.
And in his examination, okay. Then what about his past medical history?
He has undergone blood transfusion a few years ago, and he is married.
That is the family history, and 1-year-old baby as well. Okay. So what are the anyone of you? What are the important things that you feel that are coming out of this scenario?
I think usual symptoms are there. We are diagnosed in the HIV positive persons. The next thing is the hemoptysis. It might be due to the tuberculosis or in HIV positive or immunocompromised patients. They are more prone towards microbial infection. And because of that, hemoptysis
Alright, can you guys be a little louder because I can't hear.
As the patient is HIV positive and probably got it from the blood transfusion after the road traffic accident, and that caused him to be immunocompromised, and that caused some opportunistic infections probably cough and hemoptysis and non-smoking are signs and symptoms of TB, and basically opportunistic infections. One arrow can be
lung infection.
What's your one more thing? Alright, that was a good point.
As the patient is HIV positive and also his WBC count is very low, and certain symptoms like cough and hemoptysis, so pneumocystic coronary pneumonia, that's very much like common.
And one more point is very important, that he had his blood transfusion 2 years ago and his baby is 1 year old. So that means he is also at a risk of getting whatever the father had from the blood transfusion. Yes, ma'am.
The father and the wife.
I would like to add one thing that there is HIV positive. When we label HIV positive, I think it's when count less than 200.
No, that is for labeling AIDS because HIV positive is when you find the virus inside the blood, and for labeling the patient as being immunodeficient, it has to be CD4 now has to be less than 9. Yes, Irfan?
There is a point that he got blood transfusion 2 years before, and plus he's married, plus having a child of 1 year old baby, so it means they got married 2 years before. There is a time lapse of 2 years, so maybe he got infection from Lubna, HIV infection from Lubna.
Whatever that was a possibility.
And Abdullah, you were raising your hand.
I was saying that there is a reduced white cell count, that means that he can get like opportunistic infection.
So, there are also some pathology in GI causes anorexia and excessive loss in weight. So there might be some pathology in GI.
These are the constitutions that the whole body.
Please speak louder.
Ijaz?
May I add? It says here he is a child of 1 year old. He had roadside accident 2 years ago, and that's 1 year back. Another 9 months for the baby. That means there was a gap of 3 months. If he was infected with HIV, it has a latent period, and it takes time before the HIV virus becomes active or the patient actually shows signs of immunodeficiency. So although there is a risk, there is a chance, but there is no chance for the baby and the mother of having AIDS at this point, or at least or HIV. The second thing I would like to say is he is already showing signs of immunodeficiency. So the virus is probably activated in him.
Right, and you say that he is showing signs of immunodeficiency because?
Because he is coughing up blood, he has a temperature, and he is low white blood count.
Does temperature and coughing up blood indicate that a person is immunocompromised?
Because
He
he
said
is
he
falling
said one by
cell
one
count is
said-
falling down.
Yeah.
The cell count is falling down, which shows he has active infection.
Active infection.
Actually, HIV presents in some other diseases. HIV itself is asymptomatic. It presents in other diseases. The symptoms and signs are of other diseases. Over here in this scenario, the cough and hemoptysis and the non-smoking and weight loss, anorexia, is all about actually TB, because TB is the most common opportunistic infection in HIV.
Okay, so I think everyone, all of the participants have agreed to this, that it is, as the person is HIV positive, he has some sort of opportunistic infection. So let us first see like what sort of opportunistic infections are most common in the immunocompromised patients.
I lose?
Yeah, no, we write down whatever everyone knows. I think as far as I know, if the count is still greater than 200, then it can be other bacteria, normally bacterial infections. Usually the typical mycobacterium.
Fungal infections like candida.
Yeah.
Which one?
If the count is greater than 200,
Titanium.
it is bacterial. Usually the typical mycobacterium.
For those of you who are not participating, I'm watching you take part in the discussion.
If the count is less than 200, greater than 200.